Congressman Paul, we've been talking just now about Governor Perry's rhetoric, but let's talk about his record. Just this morning, your campaign put out a statement accusing him of pushing for bailout money, supporting welfare for illegal immigrants, and trying to forcibly vaccinate 12-year-old girls against sexually transmitted disease. He's your home state governor. Is he less conservative than meets the eye?
Much more so, yes. Just take the HPV. Forcing 12-year-old girls to take an inoculation to prevent this sexually transmitted disease. This is not good medicine, I do not believe. I think it's social misfit. It's not good social policy, and therefore I think this is very bad to do this. But one of the worst parts about that was the way it was done. You know, the governorship in Texas traditionally is supposed to be a weak governorship. I didn't even know they could pass laws by writing an executive order. He did it with an executive order, passed it. The state was furious, and the legislature overwhelmingly, probably 90%, I don't know exactly, overwhelmingly repealed this. But I think it's the way it was passed, which was so bad. I think it's a bad piece of legislation, but I don't like the idea of executive orders. I, as president, will not use the executive order to write laws.
What I'm very concerned about is the issue of parental rights. I think when it comes to dealing with children, it's the parents who need to make that decision. It is wrong for government, whether it's state or federal government, to impose on parents what they must do to inoculate their children. This is very serious, and I think that it's very important, again, that parents have that right. Because the problem you see is one of framing. It's the idea is, should the federal government control these areas, or should parents and localities control these areas? We have the best results when we have the private sector and when we have the family involved. We have the worst results when the federal government gets involved, and especially by dictate to impose something like an inoculation on an innocent 12-year-old girl. I would certainly oppose that.
I kind of feel like the piñata here at the party. So,
welcome.
But here's the facts of that issue. There was an opt-out in that piece of, it wasn't legislation, it was an executive order. I hate cancer. We passed a $3 billion cancer initiative that same legislative session, of which we're trying to find over the next 10 years cures to cancers. Cervical cancer is caused by HPV. We wanted to bring that to the attention of these thousands tens of thousands of young people in our state. We allowed for an opt-out. I don't know what's more strong for parental rights than having that opt-out. There's a long list of diseases that cost our state and cost our country. It was on that list. Now, did we handle it right? Should we have talked to the legislature first before we did it? Probably so. But at the end of the day, I will always err on the side of saving lives.
I want to get back to this Gardasil issue. You know, we have Governor Perry's out there and claiming about states' rights and states' rights. How about parental rights being more important than states' rights? How about having, instead of an opt-out, an opt-in? If you really cared, you could make the case, instead of forcing me as a parent, and I have 7 children too. The wide receivers here have on the ends here have 7 children each. But I am offended that the government would tell me, and by an executive order, without even going through the process of letting the people have any kind of input. I would expect this from President Obama. I would not expect this from someone who's calling himself a conservative governor.
Time. Governor Romney, you've been listening to this exchange. Who's got the better end of it?
You know, I believe in parental rights and parental responsibility for our kids. My guess is that Governor Perry would like to do it a different way. Second time through, we've each taken a mulligan or two, and my guess is that that's something you'd probably do a little differently. Second time, he just said he'd rather do it through legislation next time through. And I recognize he wanted very badly to provide better health care to his kids and to prevent the spread of cancer. I agree with those who said he went about it in the wrong way, but I think his heart was in the right place. Right now, we have people who on this stage care very deeply about this country. We love America. America's in crisis. We have some differences between us, but we agree that this president's got to go. This president's a nice guy. He doesn't have a clue how to get this country working again. And